Welcome back to the Physician's Guide to Doctoring. On this week's episode, we have a guest host, so please be the same respectful audience you are for me and enjoy. Hey, this is Brad Block, host of the Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Hey there, it's Brad. As someone who's passionate about podcasting, I've always thought there should be more support for physicians who want to share their stories and expertise. That's why we're launching Doctor Podcast Network.
We're bringing together a community of physician podcasters with one goal in mind: to provide the tools, connections, and resources you need to grow your show. So whether you've been podcasting for a while or maybe you're just starting, we've designed this network to support you every step of the way, and we're going to help each other rise, not compete.
If this sounds like something you'd benefit from, we'd love for you to join us as we get closer to launch. So you can sign up at drpodcastnetwork.co for early access. Stay tuned for more details in the coming weeks. Really looking forward to what we can create together. Doctor Podcast Network, where doctors podcast.
Doctor Podcast Network, where doctors podcast.
Doctor Podcast Network, where doctors podcast.
If you are an introvert in healthcare, today's conversation is a must listen for you. Hello and welcome back. This is Dr. Amna Shabbir, and I have a very special guest on the show with me today, Dr. Charity Hicks. Dr. Hicks is a physician and burnout coach helping introverts in healthcare escape feelings of apathy, irritability, and resentment brought on by the increasing demands and decreasing rewards of medicine. She uses her 20 years of experience in clinical medicine combined with coaching to help introverts prioritize their needs and protect their energy. She wants you to know you don't have to feel guilty for wanting a thriving life inside and outside of medicine. Welcome, Charity.
Thank you, Amna.
So glad to have you on. And one of the things I really enjoy looking at when you're posting online and just learning about your presence is you talk to introverts. And I'm just curious to know, as we just jump right in, what is your definition of an introvert? And when did you yourself started identifying as one?
Yeah, so that seems like a good place to start. The formal definition of introvert is to turn inward or direct inward. And so at the heart of it, I think when we're thinking about introverts on one end of the spectrum and extroverts on the other end of the spectrum, is really about how we replenish our energy and gather energy to us. So at the end of the day, when you're wiped out and you're beat, what's the thing that makes you feel good and props you back up again? Is it more retreating into yourself or moving towards others? And obviously, none of us are like 100% this or 100% that. We're on a spectrum. But yeah, so I like to talk to people on this end of the spectrum. And as far as when did I first know that I was an introvert, I don't know exactly when it was, but I do remember. So when I was in high school, I was a cashier at a grocery store, and there's a lot of small talk with that. And I remember I was still at it, and I always wanted to just have a button that had the answers, all the common small talk questions. So I knew at that time, like there was something there. And then I think around 2012, the book Quiet by Susan Cain came out, and I felt really vindicated by that book because I think a lot of introverts feel a little different or a little misunderstood. And I was like, oh yeah, see, that's my crowd out there. So
That's an interesting journey, and I can definitely relate with parts of it. Do you feel almost it's like you said that there is no rigidity in that definition? Sometimes I have started using the word that I am an extroverted introvert because what I feel is I love communication, talking. I don't like small talk either, but I will have these conversations when I'll be present with other people, but then it's almost like I reached my people limit for the day and then I need that time to just be by myself. So more so, what are your thoughts on terms like this?
yeah, no, it's the definition or the label isn't as important as recognizing the need. And so I think wherever you land on the spectrum is what you're recognizing is, yeah, I love being with people and having interesting conversations. And at some point, then I need to retreat. And even extroverts have to have alone time sometimes. And Yeah, it's just like how often do you have to retreat into that solitude? And one thing I'll just bring up really quickly is a lot of times people think that introverts don't like people, and that's not true, or that they're shy or anxious. Some introverts are, but that anxiety component can be introvert or extrovert. And so that can be, some people are like, oh, if I enjoy talking to people, then I'm not an introvert. Introverts enjoy talking to people too. It's just, as you said, at some point there's a limit, and then you need to retreat and build yourself back up.
And I know that when we were scheduling this interview, it took us a hot minute after encouragement, because I know that you have so much goodness to share with all of us. And I really like that definition of recognizing our energy limits and almost what are we going to do about that. But before we jump deeper into it, in healthcare, we are expected to have this certain level of presence and where we're processing not just complex emotions that are occurring within us, but also around us. And so the level of people skills that's required, and not just the skills part, like you've said, it's not that we don't have skills, but how much can one as an individual gauge and cope with? So, what are some of the struggles that you see introverts go through in specific as they work in healthcare?
So I think, and again, since I look at burnout, or I think about burnout a lot, we already have that stress on within healthcare for everyone, right? It's an ongoing thing. And then I feel like introverts have an extra level of that burnout risk because they are expending more energy. So because introverts do like a long time, you think about an average day in a clinic or an average day at work. Unless you intentionally take a long time, it's rare. You're around people all day long. You've got people coming at you, needing different things. And so that can be a challenge. Introverts can be very sensitive to emotions and external stimuli. And so that creates two challenges. One is just that constant interaction with people. You can be more likely to take on people's emotions. A lot of introverts are empaths, and which is great in patient care, right? But if you don't know how to set it down, that can also be very draining. Another thing that people don't consider a lot is the effect of the environment. So you think about all the bright lights, the loud noises, there's not so great smells, like all of these things can wear on your energy without you realizing it. And then again, there's that need for silence or calm, which a lot of time is completely opposite of what healthcare is. I feel like healthcare is a very extroverted environment. And so it can be challenging just to show up as an introvert. And then one last thing I would mention is introverts tend to be very observant and notice a lot of detail. And so when you're taking all that in, there's so much within healthcare that, like, the paperwork and the calls and the fielding emails and all of that, again, just creates a drag. And they can be things that are so commonplace in healthcare that you don't really pick them out and you don't think of them as something that's impacting you. And then at the end of the day, you get home and you're exhausted and you're like, why? It was just an average day. But they're still pulling the energy away from you.
The average day in healthcare definitely looks very different than the average day in a lot of other professions. And you're right. I really want to echo that 360 degrees overstimulation that you talked about, from like bright lights, sounds, noises, alerts, bells, in basket, just the sheer volume of the intensity and pressure of what we deal with, like all of it just comes through. And the other part that I became more aware, like it's something that I always felt was present, but became more aware when I started noticing what you post online. And by the way, for anyone listening, you have to follow Charity on LinkedIn. She has amazingly beautiful posts with these amazing pictures from nature. And so that was the part where I felt like, wow, the absence of nature and the presence of this sterile space that's very overstimulated creates a very different experience. I would love to hear your thoughts, and why do you talk about nature so much in specific? It's great, but when you talk about introverts, and share a little bit about that, please.
Yeah. So for me, nature is my go to place to decompress. And there's been so many studies. I think someone even, I can't remember who the author was, but they coined it as vitamin N, right? There's been so many studies that show how nature contributes to our well being, especially our mental well being. And you don't need a ton of it. I think there was a study that was like 20,000 people, and they found like the people that spent like 120 minutes a week or more in nature, they rated their well being much higher than those who were not in nature. And it's one of those things that's free. It's easy. To me, it just seems natural to go to nature to feel better. And so with my posts, I always figure, yeah, it's fun to, I don't love being in front of the camera anyway. And so I always, with my little nature shots that I like to share with my posts, I always figure that's just a little nugget of nature that even if it's scrolling by, that I can share with people to help create a little sense of calm, a little escape away from, like you said, this sterile environment. And that you forget when you're in healthcare, you're not even in places where the windows open, right? To get fresh air. It's just recirculated air, it's sterile environments. Yeah. So that's why I like to make my posts.
And the pictures that you share really are stunning because you're right. Even if it's during the scroll, I once did this. I opened a post of yours and I looked at the picture. It was just so beautiful. And I allowed myself just to stare at it for some time. And you're right. A lot of times we're going at the time it's dark outside and we're leaving when it's dark outside and we're missing a lot of the beauty that nature offers us. And so as we talk about this need to manage our energy, and how do you approach that when you're working with your clients and you're trying to essentially calm these overstimulated humans that are expected to behave in one way? And we know the stats for burnout. We don't even need to hash those out, but how do you help people manage their energy?
So one of the things that comes to mind right off is I do like to help people create white space and take things away before we start adding things in. And then creating that foundation that we all need for the foundation of self-care, nutrition, exercise. Because if you're not physically energized, you're certainly not going to be mentally energized. So that's just the foundation. And then the next thing is creating awareness. And you just mentioned like, oh, after I started looking at your posts, I thought about this way that I had never noticed. And so creating awareness and knowing what are the things that bring you energy, because again, we're all different, right? And so what brings you energy and what also drains your energy so that you can start doing more of what gives you energy and less of what doesn't. And then especially for introverts, because again, that can apply to extroverts as well, but especially for introverts, I always think of like micro changes. I talk about small steps a lot. I talk about micro changes, micro environments. And so creating spaces at work that are comfortable to you, paying attention to your environment and what are little tweaks that you can do within the environment to make yourself feel better. And we can talk about a little bit of those details. And another thing that is for introverts draining is just trying to show up as someone else and be extroverted and cheery and on. A lot of introverts feel like they have a different persona at work than they do at home. And so giving yourself time to and acceptance of, oh, these are my needs. And so we work on that is accepting yourself because then you're willing to show up and tell people what you need. And then a big thing is making a plan ahead of time. So if you're going to have a super busy day, like you're double booked or it's going to be a busy schedule in the OR or whatever, is making a plan and knowing, oh, this day's going to be super busy. So I'm going to give myself a little extra love in the morning, or I'm going to plan something that's peaceful and calm for the evening, and looking at different ways to give yourself micro breaks during the day or practices that are calming. Like you said, opening up the phone and looking at a picture of nature. If you can't get out in nature, you can even have like your screensaver be nature. Like there's just little different ways to sneak them in a little bit during the day, knowing that a lot of your schedule is out of your control. Because I know what I found a lot of times is some of the typical advice for introverts seem more amenable to people who like were in corporate, where you're like, oh, you just schedule your meetings in this way and leave space between meetings. And like, we don't have that option when you're seeing patients, right? You don't have the option to be like, I'm going to schedule a 15-minute break. Yet sometimes your break is just giving yourself a couple of minutes in an exam room or even when you're in the restroom. So you have to be a little bit of creative with it.
That was wonderful. And I'm just going to pare back what I heard. First of all, allowing ourselves to create those white spaces and you help folks declutter. We think that we can do it ourselves. To be honest with you, all of us can start to get the ball rolling, but it's surprising how with somebody else's guidance, you can have so much more clarity. So number one, creating that white space. Number two, the micro changes in the environment that you talked about. And number three, trying to work on that pseudo cheeriness that you feel compelled that you have to bring to work all the time. And how can you find that middle ground? And I love that you talk about looking at acknowledging the uniqueness of a healthcare professional's schedule. As a clinician, if you are in other roles, how can you then modify your schedule accordingly? So you mentioned a little bit more diving deeper into the micro changes in the environment that one can make. Share a little bit about that.
Yeah. Again, I think about paying attention to your five senses, right? So even this might sound strange, but a lot of introverts are also highly sensitive. And so even if you have like clothes that are uncomfortable or you're wearing uncomfortable shoes, like that's all pulling your energy and dragging for it. So like making yourself physically comfortable. It could be audio like music. And again, some of this depends on how much control you have over your environment, but bringing music in, visual, like you could bring a plant in or a screensaver that feels relaxing. Yeah, like some people enjoy essential oils. You have to be careful with that in larger spaces because what person loves someone might not. But that's where I look a lot in terms of the environment is just what are those things when you're paying attention to your five senses? What are those things that make you feel a little calmer, a little more relaxed? And then how can you give that to yourself in your space? And that's especially helpful if you have your own office. Like I can see like you have a plant behind you. And that it's relaxing for me being in this call with you. And I'm sure that it also creates a sense of relaxation in your office as well.
Well said, Charity, because here's what I would absolutely echo with, and I talk a lot about this as well, is embodied presence. Sometimes it's like we're a bunch of heads. Most of the time, we're a bunch of heads, and we totally forget our physical presence and the rest of our body. And so, really recognizing, oh, where you are, and then what are those needs that you're having, as you mentioned, like tuning into your five senses. Most of the time, here's what's happening. We all need to go to the bathroom and we didn't because we didn't remember. We all need to drink water and we didn't, and introvert or extrovert, both. And so, like, really pulling into that. And then you're right. We don't have a lot of control on the spaces that we're in, but then we also do have control. And so, before we are that quick to just give up our autonomy, it's also really important to lean in and recognize, okay, what are the things that I can do for myself? Because yes, we work in a broken healthcare system. No one's going to come tomorrow and fix everything for you. So you have to recognize no one is coming to save you. So what can you start doing today to create that space where you can manage your energy better and honor your own needs?
That's very well said. Yeah. And again, I always also talk about bringing in creativity and play. And so just approaching it from a playful way and like, what's a little way I can treat myself in the middle of this super hectic day? And again, it might be something simple. Oh, I love this. I love this tea. This is my favorite tea. And whenever I drink it, it makes me happy. And so giving that to yourself during the day. When we're in such a hectic schedule, it can't be like, oh, I'm going to go give myself, 40 minutes often. Sometimes 5 minutes sounds like a luxury, right? So it's just getting creative and getting a little playful and finding ways that you can just incorporate a little bit of feel good and sometimes that energy, like when you're wanting to rebuild up your energy, like some days you might need more calm, relaxing, subdued, something just to let yourself settle. And other days it may be something that, oh, I want some more cheery music or I need movement or something that raises the energy that way. And even knowing that distinction is important. It's like you need something that's like high energy or like more calming and relaxing.
Wonderful. And when you're working and you're like talking about all these with your clients and you're helping folks out, what are some of the resistance or like barriers that you might notice like people are a little suspicious of those recommendations maybe or hesitant to like follow through because change always brings up hesitancy in all of us.
Yeah, I think that we're in such a logical system, right? Like the healthcare, it's all the evidence based. And so I think it's just getting over the logic of it, making up new words. And as you talked about, just embodying it, try something out, play with it, experiment, do it for a week. And if you're like, this was stupid and it didn't make a difference, cool. You did an experiment and you move on. And then try something else because I will tell you, you can surprise yourself at what little things can change the day. And I will just give an example of myself right now. For years, I've read about start your day with a smile and envision yourself having a good day. And it sounds super cheesy. And I would try it before, and I found it really surprisingly hard to smile, like to wake up in the morning and just smile first thing. And this is so silly. I'm like, okay, I'm going to do it for 30 days. And now that I've actually done it for 30 days, not quite, but almost, I'm like, yeah, it shifts how I start my morning. And so I think it's just that willingness to experience and not have all the evidence ahead of time.
And being open to receive that. It's beautiful. What is something you wish younger Charity would have known? You are an ophthalmologist by training and you've done so much in your life. Looking back, what is something you wished you knew at that time? And I'm saying this with the thought that a lot of us are hard on ourselves. I mean, why am I not that cheerful and, loud and naturally trying to draw crowds and stuff? So what would you say to yourself?
I guess the thing that comes to me is, again, we touched on burnout a little earlier. And the thing that comes to me with introverts is knowing and recognizing and paying attention to that fine line where you're like, yes, I'm taking my alone time because it's solitude and it's re-energizing and it's nurturing to me versus I'm trying to deal with burnout and I'm trying to deal with all these things at work. And so now my alone time becomes isolation. And I think that's one of the big things. And so sharing your experience with others to find community. And I actually so it always reminded me of this little poem, this Shel Silverstein poem. And I wrote it down so I could read it for introverts, because I think it's funny now, the more that I've started talking about introverts, and it's like a little Me Too movement on its own. Like I have people coming in and feeling like you're part of something. So this little Shel Silverstein poem was called Masks, which introverts are often masking as extroverts. And so she had blue skin and so did he, kept it hid, and so did she. They searched for blue their whole life through, then passed right by and never knew. And so some of that is just sharing your experience, because I can guarantee there's someone near you that is feeling the same thing. And there's something about having that shared experience and knowing you're not alone in your needs and how you need to be to thrive.
Thank you for sharing that. And community really validates our shared human experience. Like it is one of those a common humanity, and finding that element of community where we can. And that poem was beautiful. So as we wrap up for today, Dr. Hicks, what would you like to leave the audience with? Any final words of wisdom? And of course, any resources you would like to share with us?
Yeah, I think the big thing is I feel like introverts spend a lot of time, I don't know if it's feeling bad, but certainly feeling maybe less than for not, like you said, extroverting and showing up in that flamboyant way, or not feeling engaging enough. And really, introverts, especially in healthcare, have a lot to offer and have a lot of strengths. Again, like I said, they're empathic, they care, they want deep connection. And so I guess what I would say is just focus on your strengths and not worry so much about the things that society might make you feel like you're missing. Because when you're always worried about what aren't, you're shortchanging yourself and you're shortchanging the people around you, because you already have a lot of strengths to share.
And I want to just ask in there as well. I know we're in the wrap up phase, but I really want to ask this question. What can we, the non-identifying introverts, the other people, do better to support our introvert colleagues?
I think it's not any different than in any situation, is always asking, keep understanding what people need, asking them what they need. How can I support you? And that goes for all of us. And I think a lot of us are used to getting the questions that the person doesn't really expect an answer, like how are you? And you're expected to say fine and then move on. But really asking someone like, hey, how can I support you? And I think we would all do better to have that.
I agree. I so agree. So how can our audience connect with you? I know I mentioned LinkedIn, and anything else you would like to share.
Yeah, So I have a website. It's charityhicks.com, and Hicks is Hix. I always say why use three letters for when one letter will do. So it's just Hix. And I am going to put on there and on my website resource for introverts, for energy management for introverts. And I'll give you that link to put in the show notes. But just to deep dive a little more and give more specific strategies in different situations, because I know we have limited time here. So that out there. And and I can also, if anyone wants to reach out, I can also be reached at hello@charityhicks.com.
Wonderful. Thank you so much for your time today.
You bet. Thanks, Amna.
Thanks for listening. I have a favor to ask. You listened to the episode until the end, which means you either fell asleep or you really liked the episode. So please share it or like it or comment on a social media post or write us a 5-star review, something. It would really help me out. And maybe what you learned from this episode can help someone else too. The views expressed in this episode are those of the interviewer and interviewee and don't represent the views of their employer or even their significant other. Even though the magic of podcasting make it sound like I'm talking directly to you. This is not a doctor-patient relationship, and this is not medical advice or financial advice or really any advice. Thanks again for listening to The Physician's Guide to Doctoring.